Hi there, you're welcome to DemiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit that like and subscribe button. That way you're able to get alerts anytime we post our other educating videos, and also being able to stay subscribe to our channel to also help us support our community here at DemiRx Care. So what is our topic of choice today? So our topic today is amlodipine. So what is amlodipine? So amlodipine is an oral medication that's normally used to treat our patients with high blood pressure. So patients are usually taking this medication for high blood pressure. It can also be used for chronic stable angina, as well as a silent myocardial ischemia, also known as MI. And also patients can also take this for pulmonary hypertension as well. So the medication comes in a 2.5 milligram, a 5 milligram, as well as a 10 milligram dose. So our maximum dose in patients is usually the 10 milligram dose, and we don't want to take higher than the 10 milligram. All right, so this medication is very effective in lowering blood pressure, and it's also one of the common first line or first go-to medications that they would prescribe for a patient who has just been newly diagnosed with high blood pressure. So what are some of the side effects of this medication? So one of the major side effects of this medication is swelling. So it can cause swelling in the feet. Also, this medication can cause flushing. For patients who don't know what flushing is, it's just a sudden redness of the skin due to like the way our blood vessels are like dilated. It kind of causes that redness to appear. Also, in patients, it can also cause headache as well due to that dilation of the blood vessel. So usually with high blood pressure, we want to make sure that we're opening our blood vessel in order to help that blood flow very well in order to help decrease that blood pressure that's going on. So the way it happens is the amlodipine comes in and it dilates that which means it widens that blood vessel in order to decrease the blood pressure. So dilating the blood vessel can cause headache. So usually when headache happens, it is known as dilation of blood vessels that are in the brain that causes that headache to happen. All right. So this medication can also cause dizziness. Some patients say it makes them sleepy. Some patients say it makes them tired. So just make sure you're looking out for the side effect. If it becomes something that you can't really, that you don't find very favorable, then you want to make sure you're reaching out to your doctor to see how they can help with those side effects. All right. So in our patients that have heart failure, you want to make sure you're taking caution with amlodipine because of that swelling, because it's known that that swelling that happens with amlodipine is due to a fluid retention in the body that might also make the patient gain weight, that fluid due to that fluid retention, or our body holding on to more fluid than it's supposed to. So in heart failure, these patients are known to already have that high amount of fluid going on. So you don't want to give them a medication that's going to increase the amount of fluids that their body is holding on to. All right. And also in patients that have a liver dysfunction, you want to make sure that you're taking caution with amlodipine as well. So what do you need to know while you're taking amlodipine? So amlodipine can be taken with or without food. You can choose to take it in the morning or at nighttime. Usually I normally tell my patients to take it at nighttime. That way, if you are going to get those side effects such as headache or dizziness, you're already sleeping and you're not going to feel those side effects. All right. So another thing where amlodipine is, because of that swelling, you want to make sure you're taking a vitamin B complex, and that what that vitamin B complex is going to do is decrease that fluid retention, or how much water your body is holding on to, and kind of help decrease that swelling that's going on in your toes or lower parts of your body. And that vitamin B complex kind of help reduce that side effect. So in patients who are pregnant, amlodipine is not really recommended because there's not sufficient evidence that this drug is not going to affect the baby. So they have other medications that they normally prescribe for our pregnant patients, such as labetalol, which they would normally take in while they're pregnant if they have high blood pressure. So with that being said, if you do find out that you're pregnant while you're on this medication, make sure you reach out to your doctor immediately so they can switch your medications if as necessary. Okay? All right. So if you do miss an amlodipine dose and it's past 12 hours, just skip that dose. Do not double your dose. Remember, I told you that the maximum dose is 10 milligrams. So you don't want to double your dose regardless of what milligram that you're taking if it's past that 12-hour mark. That way you're not decreasing your blood pressure more than normal. And your body is not like, whoa, what's going on here? Why are you taking 2 pills? So just to make sure you're keeping that in context. Another thing is with amlodipine, you have to give it time. Especially with high blood pressure medication, we recommend giving it about 3 to 6 months before switching to another medication to make sure that you get that full effect of that medication before switching over and saying, oh, my blood pressure is not decreasing, we need to take another med. That's not how that works. The blood pressure didn't develop all of a sudden, most likely. So it took time for it to get there. So you got to let it slowly get back to its normal blood pressure. So taking this medication for about 3 to 6 months and seeing how well that helps before saying, hey, I don't want to try this medication. I want to switch to something else. All right. So I hope this video was able to help you in terms of what to look out for while taking amlodipine, as well as other caveats of this medication. If you did enjoy the video, make sure you hit the like and subscribe button. That way you're able to get alerts anytime we post our other educating videos. Please thank you for your support here at Demi Rx Care Community. Thank you and stay blessed.